Hi everyone, I'm Dr. Sally Foote, veterinarian and animal behaviorist. So we're gonna just take a couple minutes here to let some people get signed on. Great to see you. I hope you're all everybody's having a good, warm up to the holidays. I know the northern Midwest is getting ready for a lot of snow, a lot of storms coming in. So I hope everybody takes it easy, and is safe. Okay, so I'm going to go ahead and get started. So hi, I'm Dr. Sally Foote, veterinarian animal behaviorist with over 35 years of veterinary practice experience, owner of OCA Veterinary Clinic, one of the first low stress handling certified clinics, and also having a certification in animal behavior. And now I focus all my work in helping veterinary staff, especially shelter staff, with low stress veterinary care, understanding behavior, how to intervene early, as well as I provide telehealth veterinary behavior consultations. So today's topic, I thought it was pretty timely. I have my emails coming in, and one from Clinician's Brief has this summary article by Dr. Bonnie Beaver. Dr. Bonnie Beaver is one of the original, just the queen of behavior, in my opinion. She wrote the first feline behavior book back in the 80s, which was a spark for me personally to be interested in behavior. But anyway, she wrote this article. It's like a summary, a capsule article for Clinician's Brief on the effectiveness of canine aggression treatment protocols. So I read not only this, I went to, because I do receive the Journal of Veterinary Behavior, and I went to the full article. And so I'm going to go ahead and, review and kind of go through the findings here that Dr. Beaver has put in a capsule, as well as I did go to the full article and pull out just a little bit more. So from this study, well, let's put it this way. It was a survey, okay? The Canine Behavior Foundation that Dr. Nicholas Dodman is head of did a survey of dog owners previously, and so they're going back to that same group of people who filled out an initial, just a different survey about canine aggressive behavior. And there were 963 dogs in this study that belonged to 800 people. So some people had more than one dog, that they were answering the survey for. And these were dogs that were defined as aggressive. About 53% of the dogs were mixed breed. 56% of these dogs, of these dogs in this group had gone to some kind of a professional. So this meant some kind of a trainer that had certification by the professional dog training group in canine behavior. There's this like a highest level of certification by the CCBDT, all the way up to the American College of Veterinary Behaviorists. Okay, so this was any one of these various certifications: an applied animal behaviorist, someone with a certification by the International Association of Animal Behavior Consultants. Okay, but 53% of this group of 800 owners had gone to some kind of a professional with credentialization. About 81% did go to a trainer. So it could have been it may have been people without credentials. Some of the other things to note is that 22% of these dogs, these 800 families, had gone to a veterinarian. And from reading this, I'm going to assume it was because they went to the veterinarian seeking advice and guidance for what to do about this behavior. So all the dogs presented to the veterinarian with a behavior problem, 15% of those dogs were found to also have a concurrent medical problem. So that's pretty significant. If you've got if I have 100 dogs just brought forward saying, hey, I don't know what's going on with my dog, but he's just not acting right. And 15% of them I find have a chronic skin condition. They may have pain from, pain from arthritis, or maybe they have a GI problem, also with a behavior problem. That's a pretty significant number. So both have to be treated. 98% of these dogs, of these 800 dogs, were getting some kind of behavior modification. So what that means is that, remember, 56% went to a higher credentialized professional, even from a trainer, there was some kind of recommendation to modify the behavior in a positive way in these dogs. Okay, so the aggression categories that were part of, that were asked about and then, subsequently subdivided were conflict aggression. 24% of the dogs had conflict aggression. 35% of the dogs had housemate aggression. 72% of the dogs had fear-based aggression, fearful of other people, but it was called fear aggression. And 14% had predatory aggression. So these numbers are going to total over 100 because some of these dogs had more than one category of aggression. If there was more than one category of aggression, it decreased the successfulness of an aggression plan, which of course, is pretty typical. The more problems you have, just like a health problem, if I've got an animal with 5 different health problems, it's harder to manage those 5 than if I have one. Same thing with aggression. With 5 different types of aggression going on, it is more difficult to create the management plan and any medication plan to modify and reduce that behavior problem. Okay, now what worked? Okay, first let's start with that. The majority of these dogs, what the dogs responded to were what was the most positive to decrease the aggression was for the dogs to habituate to the triggers, what was causing the aggression. Now, habituation pretty much is desensitization and counter-conditioning, which would be done in a very gradual way, in a very controlled way, to prevent the dog from going up to aggression, from practicing those behaviors or to stimulate them, etc. The second most helpful procedure done, if you want to call it that, was relaxation protocols. So for this dog to learn to lay down and relax, to have quiet time, and of course that has to be done in a space that is stripped of the triggers for aggression. So you see there's a lot of environmental management, meaning like let's prepare the home, let's maintain the home to decrease the triggering that even gets them built up or started. And that these sessions would be done in short sessions. We would not be doing 30 minutes or an hour of a relaxation protocol. It may have been, it didn't define it in the study, but it may have been just 5 minutes a few times a day. So short sessions of desensitization, of habituation and relaxation protocols was what helped to give most change and improvement in aggression rather than longer like half-hour or hour type sessions. Now, what gave poor results or did not help with reducing the aggression as much was, they called it response blocking, which is where, say, if the dog now suddenly starts to lunge up, then we've stepped in front of them, we body block them. Or maybe there's a baby gate separating this, in housemate aggression, for example, a baby gate separating this dog from the other housemate dog, yet the housemate dog may walk really close, coming into the aggressive threshold distance. So now the other dog behind the baby gate lunges up. So he's blocked from actually biting the other dog, but he's still triggered up to the behavior. He's still practicing the aggressive behavior. So blocking had the least amount of positive response or change in outcome, and timeouts. That if the dogs were put in timeouts, which usually is like kind of a training technique or a technique used when the dogs have again gone up to aggressing, they've gone up to stare, they've gone up to growling, they've gone up to lunging. So again, we are having the dogs getting into the aggressive behavior when we're now applying timeout. So while timeout is needed in a moment, we don't want to rely on that as a primary method of managing these dogs. 99% of these dogs had obedience training. I'm sure a lot of you out there who are behaviorists, whether you're veterinary behaviorists or non-veterinary behaviorists, you've had background in training, special interest, whatever. We all hear it, right? Well, I took my dog through training class and he does great for a sit and a come, but oh boy, he lunges on his housemate. Or strangers come in the house and he just suddenly lunges up and attempts to bite. So 90% of these dogs had obedience training. So that meant they're very trainable. They are trainable. But obedience training is not the same thing as this dog learning to socialize, to become habituated or accustomed, desensitized to what triggers them to aggression. And obedience training also then may not be teaching our humans, our students, our owners how to recognize the body language of anxiety, which then oftentimes is leading them to aggression. Now about the drugs. Okay, I want to know about the drugs, right? Okay, so medication facilitates learning. It can help with learning. It is not directly treating behavior. And what I appreciate about this survey study is I feel that this is showing this. Yes, there are studies that show that, say, using fluoxetine decreases aggression successfully in many dogs, being treated for aggression. But this study kind of looked at things from a different way. Instead of taking a group of known dogs on this medication or not, it was taking a much larger pool, and especially where there was much more, some weren't even getting in front of a veterinarian. They were not getting in front of a credentialized trainer. So 21% of the dogs, so 21% of these 800 dogs were on medications, and all of these dogs, 120 dogs had used fluoxetine, but only 80 were regularly taking it daily at the time of this survey study. So there were dogs who had been on fluoxetine at some point and then came off of it. And why, it's not necessarily clear. It could be because didn't see it to be effective. Side effects like lack of appetite, maybe liver inflammation, or non-compliance. Just non-compliance. That could be another one. 66 of the 800 dogs had used trazodone. 24 were on it on a daily basis in this study. And the third most commonly used drug was diazepam, where 39 of the 800 dogs had used diazepam with 13 on it. Now, other drugs were listed, like clonidine and paroxetine, alprazolam, but the numbers of dogs on it were just, lower, like 9 and 8 and 6. So of these dogs that were on the medication, there was not a significant difference in the improvement of their aggression as compared to the dogs who were not on medication. Now, why would this be? Okay, if the drugs are there to facilitate and help with learning, why were we not seeing a difference? So in the discussion of why was there a limited, limited response, not as much improvement because of the drugs, in the discussion, they felt that there could have been, first of all, these dogs were pretty established in their aggression. The average age of the dogs in this survey study was 6.75 years of age. Range was around 2 years of age, up to, I believe, 12 years of age. Okay, so, but the average, the mean, was 6.75 years of age. Now, I did not see an answer as to how long aggression had been going on, but pretty much these dogs probably had been displaying, going up to bite levels for at least a couple years. So this is very strong learning in their brain, in their memory, and you cannot reverse that learning. It's that combination of decreasing the environmental stresses, having the triggers stripped away and reduced in the environment, then the medication is to help improve brain chemistry so they can remember the steps of the desensitization, the counter conditioning, the relaxation, etc., that they're doing. And in these dogs in this study, they did not see a significant improvement. So some of the thoughts were, if it's been going on for a long time with this dog, maybe they didn't have enough, the dogs had not been on the medication long enough to see a difference for when this study was done. Some of these dogs might need to be on these medications for, while it takes 4 to 8 weeks to establish the blood level. After establishing the blood level, then you need that consistency in the brain, with that increased serotonin, increased dopamine, to have that baseline of the brain to be able to learn. So maybe the study was not long enough to really see the difference that medication makes. Secondly, lack of compliance. Did the clients give the medication according to the regular dosing schedule, at the dosage recommended? They could have dropped off on giving the medication. whatever. There's always a concern for lack of compliance from the client. And is this behavior so ingrained in the memory of this dog? In other words, that the dog had been practicing this behavior for so long that there is a physical, like, automatic body response to this, as well as like deep memory for this, how to react to the situation around this trigger. Is very difficult for the dog to learn a different response, despite multiple different ways of managing the environment, desensitization, counter conditioning, relaxation, etc. It's really difficult to change the behavior the longer it's been established, even with the help of medication. That might be part of why the medications were not making a significant difference in this group, in this study. So I feel that's a really important aspect of this. And it's not to say that medications don't work. Yet what it is to say is that, as well as that 15% of dogs who were in front of a veterinarian, for, hey, my dog's aggressive, what should we do? What's going on here? 15% of those dogs had a medical problem. So what that says is, veterinarians, we need to always be asking early, whenever an animal's coming in with a health problem, infected ears, inflamed skin, GI problems, gait problems, arthritis problems, knee problems, okay? We need to be asking, how are they behaving? Now, here's a tip. The word aggression, the word aggression is heard as a judgment. If you say to your client, hey, is your dog showing any aggression? They'll say, oh, no. Even though the dog may be growling, maybe lunging up, because to the client, and I have to be honest with you, this is how I was taught as a young veterinarian, aggression equals biting. They have bitten, or broken skin even. They're not aggressive unless they have broken skin with the bite. Now we know that's a level 3, an elevated bite, and the prognosis for improving the aggressive level in the dog really goes down once they've not only bitten, but bitten and broken skin, okay? But to the client, the average client's knowledge, if we use that word aggression, they're going to be telling us no, even though there are problems in the home. So here's the way I phrase the question back at my OCA vet clinic at general practice, and I still do when I do relief from into practice. Tell me what your dog's doing that's driving you crazy. Okay, that's kind of a lighthearted way. What's he doing that bugs you, driving you crazy? Oh, you'll be surprised at things you hear. And it's good to hear them, because now you can give advice, you can give handouts, you can send them to a consultant, etc. earlier. Okay, so that's the first one. Because if they say, oh, he just growls at the kids when they're running around doing cartwheels. Okay, but we have a bite. Let's do this, right? So say it that way. What's your dog doing that's driving you crazy or bugs you? Okay, just simple as that, and listen. Zip the lip and listen. Your technicians can ask this question. You can jot it down. You can do a lot of intervention for you. It could be a question on an online form that you get with every exam, but always ask it. Okay, always ask it, all right? Now, the second thing is that clients are demanding drugs. They're demanding drugs right off the bat. I have had a recent, I don't know, the holidays always are stressful for pets as well as people, so of course we're seeing more dogs who are now attempting to bite or showing more fear. And they're being referred to me, through other veterinary clinics. And the good thing I would say is that these clinics are knowing, okay, we might start them on fluoxetine, we might start them on trazodone, but I'm only going to limit this prescription, say, for 30 days or 60 days. We can't stay on it, because this is not treating the problem. We want to get some initial benefit, or see if this gives initial benefit, get you to the consultant. Some of the veterinarians, which is the best thing, to say, I'm not starting anything until you've had that consultation, so I know what to use and I know what would be most effective, okay? But the clients are demanding drugs first. I just was at some friends' practices and they said, they all are just saying trazodone, 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 give me trazodone. And, so there's a pressure on the veterinarians to give meds, and just get me started on that, which is not really the best way to do it. And this study is showing also that, hey, the meds are not necessarily going to be that effective. And so we have to get that evaluation done. We have to get that consultation done, okay? So I think that's also really important of this veterinary. So veterinarians now, veterinary staff, you need to know specifically who in your area is credentialized, not just any trainer. And then now the American Veterinary Society of Animal Behavior, I believe, has a paper, and I believe there's also a white paper on the American College of Veterinary Behaviorists website that describes these different, initials and credentializations for trainers, non-veterinary behaviorists, and veterinarians who are special interest in behavior like myself, or those who are American College of Veterinary Behavior. So that alphabet soup, it's giving you the definitions of the alphabet soup. Download that white paper and have it handy. Post it somewhere in your office you can readily see. So now you can cross-match. If there's someone in your community, what's your credentialization? What does that really mean? What do you know? Secondly, utilize the veterinarians who are providing telehealth behavior consultations. There's so much that you see in the home through a telehealth behavior consultation that you would never see doing a house call, because the behavior of the animal changes, the behavior of the people changes. It's all different. You need to do it by, even if it's a blend of in-person and telehealth consultation. I've been providing telehealth consultations for the last 9 years. It is not about the pandemic. It's about my personal safety and my staff's safety, because the bread and butter is the aggressive dog. And that aggressive dog who may have needed to ride in a car for an hour and a half or 2 hours to come to my office around people he doesn't know, and part of his primary problem was aggression on people he doesn't know, isn't really a recipe for a less stressful examination if I want to do the physical exam on the dog. We've just made them worse in essence, as well as being safe myself or my staff. And we can't hardly get them coached into how to doing some of the desensitization and counter conditioning. And lastly, we are not the environment that they're having the problem in. And no matter how well I ask clients for video, for photographs, whatever, it was not the same as when they would click on and we'd be there on Zoom, Facebook, FaceTime, Apple to Apple, Skype, whatever. It really doesn't matter your platform. In those quick moments, I could see the brewing behavior, and I could call it out. I could say, see, his ears are down, his tail is down, as you just took 3 steps forward to your dog. I'm like, what? Yep, now they can recognize it. And then you could record it, you could share it, and then I work together with the primary care veterinarian. I do not prescribe, I do not prognose, I do not diagnose, I advise. And then I have my vet-to-vet consult as a part of the service. Veterinarians out there, please seek and find the veterinarians who provide this. There are some of the boarded veterinary behaviorists who do provide this. There are people like myself. You can go to the AVSAB directory. But unifying this would really help a lot to nip these problems in the bud, especially veterinarians, if you are getting pressure from your clients to just give the meds so it all is better, okay? Non-veterinary behaviorists, go on, do your work, do the behavior consultation, but still go to the veterinarian for an assessment on medication, or combine with a veterinary behaviorist for the assessment for medication and which medication to use. Sorry, I'm referring back to my notes here. So lastly, herbal supplements. So we talked about drugs. Now let's talk about supplements, nutraceuticals, and other herbal supplements. 18%, and a different 18% of these 800 families had used a herbal or nutraceutical or alternative therapy. They were not using a pharmaceutical drug. They were using a nutraceutical or herbal or other therapies to decrease the decrease anxiety, decrease aggression, and improve brain health. So what were used were nutraceutical supplements. Now the study did not ask specifically which nutraceutical. So there is not a breakdown. Was it theanine? Was it milk calming protein? Was it B vitamin? What? That was not broken down. But the best responses did come. Some of the best responses did come from the nutraceuticals, also the pheromones. Other things that were used were pressure wraps, massage, CBD, aromatherapy, music, acupuncture, chiropractic, and visual blocking. So kind of like the calming cap, just to kind of wear so they don't see as much and everything. But the top positive responses came from the pheromones, the nutraceuticals, and the wraps. And then after that was the herbal and botanicals. So there is credit, okay? So there is credit and credence to utilizing some of the nutraceuticals and these other alternative therapies, because the percentage of dogs who had a positive response to these products is really pretty close to the dogs who received a pharmaceutical. And in the face of a pharmaceutical, other side effects like disinhibition of aggression, how well can the liver metabolize the pharmaceutical, any contraindication with an existing medication they're on for another health problem may be far less of a concern when they're on a nutraceutical. So consider using the nutraceutical. Keep that in mind. They do have benefit, okay, for these animals, for these dogs. Okay, clinician's brief. You can read the summary from Dr. Bonnie Beaver. Nice bullet point at the end. Always ask the dog owners whether the dog is developing a wanted behavior. The behavior modification for using desensitization and counter conditioning is best for managing these aggressive dogs. And lastly, keep those sessions short. Those three things are the three best bullets coming out of this article. Thank you so much for your time. Hope you guys have a good holiday season. I will put in the description, I'll get this on my YouTube channel, and I'll put the links to the pages with those, papers for these definitions of credentialized trainers and such. Lastly, also, I'll put a link for this. This is the Canine Ladder of Aggression by the wonderful Dr. Kendall Shepard. This is how, have this hanging in your clinics. Trainers hand this to every dog owner. This is how all dogs behave. And so when you say, rather than saying the word aggression, now you can point to the chart. Does your dog do any staring? Because after that, it's going to go to growling. Growling will then lead to a bite, right? In improvement, they may see those signs of anxiety. So that we're all speaking the same language. Please use this Canine Ladder of Aggression. You can download it off of Dr. Shepard's website. I also have it on my website under the both veterinary and pet owners free resources page. So you guys can get it from there. Thanks so much. Take care and have a wonderful day.